Greetings, everyone, and welcome to 7 Jars of Hot Pickled Peppers. No, this isn't about spicy cooking. It's about finding strength and resilience to recover after a stroke or any life-altering event. I'm Christine, your host and a stroke survivor. I lost most of my sense of taste after my stroke, except for hot pickled peppers, hence the name. Our mission is to help others. Let you know you're not alone. You have the courage to get through whatever life is throwing at you. Join us and join the conversation.
Welcome to the podcast of 7 Jars of Hot Pickled Peppers, Season 2, Episode 7, A Look Inside. The information and advice provided by 7 Jars of Hot Pickled Peppers, Ken and Kristina Johnson, the speakers and commentators on their podcasts, interviews, and references in the book are not a substitute for the advice and treatment plan provided by your own healthcare professionals. Further, it's not intended to be an adjunct to any existing or proposed advice or treatment plan you may currently be receiving from your healthcare professional. One of the most important things we've come to realize is that each individual in their family's journey through a stroke or major life event and its recovery is truly unique. The story and information provided by ourselves and our guests is solely intended to let you and your family know that 1, you're not alone. Other people and families have gone through what you're going through. 2, there are resources available that you may not be aware of that may help you and your family through the stroke recovery process. And 3, there may be other treatment options available. Again, please consult your healthcare professional regarding your treatment plan and do not follow the treatment plans that are discussed in the information that is solely intended and directed for Christine and her continuing care. Thank you. You can join the conversation on YouTube and Facebook at 7 Jars of Hot Pickled Peppers for our video version of the podcast. You can check out our website at 7jarsofhotpickledpeppers.com. Or you can download our podcasts on iTunes or Podbean. And of course, you can follow us on Twitter at 7 Jars. Now it's time for Quote of the Cast. We cannot teach people anything. We can only help them to discover it within themselves. Galileo.
When I was first diagnosed with my hemorrhagic stroke, I had many imaging tests done. It all started with a CT scan in the hospital of the small town where I live. Then it carried on to the big university hospital. For each test I had done, there was a whole team in place to help, showing me where to change my clothes, explaining the procedure, comforting me, making jokes to ease my tension, interpreting the results. So many people were involved, each one a gift of knowledge, expertise, and kindness to help me at my most vulnerable time. Medical imaging seeks to reveal internal structures hidden by the skin and bones, as well as to diagnose and treat disease or injury. I didn't even know half of what they could do before my stroke. Today, we have someone whose career is in imaging and is going to give us an inside look, no pun intended, of medical imaging.
Introducing today's guest. Kristina Johnson grew up in Wetaskiwin. She has a 3-year-old daughter. Kristina got her degree at the U of A in physical education and then went on to NAIT, where she got her CT and X-ray technologist. Kristina currently works at the Wetaskiwin Hospital, and she mentors NAIT students at the hospital for their practicum placements.
Welcome, Kristina. We're so pleased you could join us today to share your expertise and knowledge in the field of imaging. I'm sure just about every one of our listeners has had some sort of imaging test performed at some time over their life. So, to start things off, can you just tell us a little bit about yourself?
Well, my name's Kristina. I've basically been born and raised in Wetaskiwin for 30-ish years.
Nice.
I still live in town and I work at the Wetaskiwin Hospital. My entire career I've been there. I have a little girl who's going to be 3 in December.
Nice.
So she keeps me busy.
No doubt.
And other than that, it's really nothing too interesting right now.
Oh, it all sounds very interesting. So, what made you choose a career in imaging?
Well, that was a long, windy road to get there.
Oh,
I first did a 4-year degree in Augustana for phys ed.
okay.
Wanted to do the whole athletic therapy
Right.
until you realize that following around a hockey team for the rest of your life isn't really sustainable. So I went back to Nate when I was about 28, I think,
Oh, okay.
and decided to go into X-ray.
Really?
Just something in the medical field
Right.
that was fun and didn't take 8 years of school to do.
No doubt.
And it was either that or nursing, and nursing wasn't really at the top of the list.
Right.
So X-ray went out.
Oh, fantastic. So how long after, I mean, you had a degree already, so how long then does it take to become imaging tech?
When I went, it was a 2-year program,
Oh, okay.
so 22 months.
Right.
It's now extended to 26 months, I think.
Oh, okay. And this is already having a degree, so you have
Yeah.
the prerequisites for...
It's not really a prerequisite.
Oh,
Anybody, you can
oh.
go in right after high school.
Oh, okay. I get it. I would
I just
think
took
it'd
the
make
long
it
way there.
easier. What would be your area of specialty in medical imaging? Like, do you have to specialize in one area?
So when you graduate NATE, you come out with a little bit of everything. So you do learn
Okay.
CT, you learn X-ray, you do the fluoro, and what else can you do? There's the cardiac cath lab. Like, you're able to do any number of different things that you want.
Okay.
Wetaskiwin doesn't have some of the specialties that the city does.
Right.
And OR is another one that you can do.
Oh, okay.
So you're able to do everything. Then you can go on and further do, like I did, the CT courses. So you can get your CT certificate as well.
Okay.
Some places require it, some don't. It's up to the manager, I guess, who
Right.
gets what. But there's always room for learning. Every year we have to do 24 hours of education credits, so you can pick whichever you want to do.
Just to keep up to date
up,
on. I would imagine it's an ever-changing field.
Yep.
So what kind, like you mentioned quite a few different imaging. Would you mind just going over again what type of imaging someone could expect? Or what is available, I guess I should say?
After you
For
graduate,
people
or for
to get
people.
medical test imaging
Oh
done?
gosh, everything. As an X-ray tech, you can do even mammos too,
Oh, okay.
and CT, and then like the upper GI barium swallows we do as well.
Oh, okay.
Everything in the OR, like hip replacements, knee replacements.
Like during the surgery you'd be involved in.
You take the pictures
Really?
for the surgeons.
Oh,
Yeah.
wow. This is
So you
such a
watch spinal
huge-
fusions. You can see it all.
There's so much
Yep.
within
So you
imaging.
can, lots of them do a rotation through.
Mm-hmm.
Some specifically do like just mammo or just the OR or just CT or, but for the most part, I think everybody just kind of rotates through.
Oh, okay. So what made you choose X-ray and CT?
Well, I don't know. That's all Wetaskiwin has at the time.
Oh, okay.
We did have mammo, but that's not there anymore.
Oh, okay.
And then CT was something that was presented to me, and so I jumped at it.
So did you have to do so many hours of practicum to finish your or complement your education then, or?
Yep, the CT program, you do 3 courses online. And then you have a logbook of certain exams that you have to do as well.
So forever learning.
Yep, pretty much.
So there would be, you said you had to take more courses to become CT certified. So once you have that one layer of education, you just keep going from there to expand your knowledge. So would ultrasound be part of imaging?
It's part of diagnostic imaging, but it's
okay.
a separate course altogether.
Okay.
So I don't know too many that would do both.
Right. Okay.
They're two separate colleges and you'd have to pay two separate fees. And
Yeah.
I guess there could be somebody that would do it, but it would be a whole nother 2-year course probably.
I guess
Yeah.
so. I guess so. So I've also heard people who work in imaging referred to as technician, technologist, assistant, radiologist. Are you familiar with these different terms?
Yeah. I'd say the technician and the technologist are probably the same.
Okay.
So that'd be me.
Okay.
There are some places that have assistants, I believe, and I'm not sure what they do. Before, they would do like the filing of the films
Oh,
and
right.
ordering patients and just general stocking and stuff, I would think.
Okay.
And then the radiologist is the actual medical doctor who reads the x-rays and CTs and ultrasounds
I
and
see.
makes the final report.
Okay. So are most jobs in imaging in hospitals?
Hospitals and clinics. Yeah.
Okay.
There are several, like MIC and Insight are two of the
Right.
most popular ones around here.
Right. I've seen those in Edmonton for sure.
Yep.
So what does a typical day look like for you?
No 2 days are the same, I can tell you that. Basically, you just show up and whatever comes through the door
I guess are
is
most
what you get. So we do have some booked patients.
Okay.
And then the rest are emergency.
So how many x-rays or scans would you complete in a typical day?
In a typical day, CT can be anywhere from 12 to 20.
Wow. And that's in an 8-hour shift or
Yep,
12 hour?
8-hour shifts.
Wow. That's a lot.
And X-ray, we usually average probably about 80 for the day shift.
For one shift.
Yeah.
Wow. That's incredible.
It's busy.
That
I
is.
think we're probably one of the busiest imaging hospitals in the central area.
Wow. Because Wetaskiwin's not that big of a city.
Nope, but we service a big area.
That's true. There's a
So-
lot of rural
Yeah.
area that accesses it. Oh, for sure. So you perform the test and then a radiologist would interpret them?
Correct.
Do you provide any comments for the radiologist if you notice, like you'd be the first line for noticing
Yep.
any abnormalities?
Oh, for sure. We write down a number of things that we see just to point them in the right direction.
Right.
We also take a thorough history of most of the patients, especially in CT, like a smoking history, a surgical history,
Oh, okay.
stuff like that. So he has something to go by. And yeah, we don't do it for him, but
Right. Right, of course.
definitely if there's something we notice, we'll bring it to his attention.
Right. And then the radiologist would get it, and then does the patient's family doctor get that as well?
Yep.
Oh, okay.
So they have access to both the report and the images as well.
Oh, okay.
And sometimes the ER doctors are the first to see them before the radiologist reports
Oh,
them, so
okay.
they can
Yeah, if they've come through
Yeah.
emergency,
make
I
a
guess.
diagnosis as well.
From my own experience with stroke, here in the Wetaskiwin Hospital, I had a CT scan to first determine I had one. So, because you do CT and X-ray, can you tell us some of the steps in imaging for a stroke?
I sure can. Basically, Wetaskiwin isn't considered a stroke center,
Okay.
but we are able to do a plain head CT to determine whether the patient has bleeding on their brain or not.
Okay.
And if they do, then they won't get the TBA drug,
Right.
and they'll be monitored and probably sent out to the city anyway. If they don't have it, they are able to receive the TPA drug, which we do not carry in Wetaskiwin.
Oh, interesting.
But they have now launched a project within Alberta for a mobile CT scanner,
Right.
which can meet the ambulance on the side of the highway and administer the drug
Really?
and monitor as they go. So
So,
we're very limited in what we can do in town for stroke.
right.
If they're within the window, most of the time the ambulance will just bypass the town and go right to the mobile on the highway or right to
Right.
the city if they're within the 2 to 3 hour time
Right.
frame still. If we're over the 2 to 3 hour, then we just monitor with a head CT and then a
Okay.
follow-up within 48 hours.
Okay.
So that's basically all we do in town for stroke.
Okay. Oh, very
But there are many
interesting.
other things that they can do in the city,
Mm-hmm.
like the head angios and
Yeah, I had
further
a
testing. Yeah.
yeah, I had that done when I was in the city. So it seems like within each medical imaging area, there's a multitude of different tests that can be performed depending on the needs of the patient. So within your specialty of CT and X-ray, can you tell us about some of the tests you do?
Yep, we do a wide variety of testing. In X-ray, it's basically to look for fractures and free fluid in like your
Okay.
lungs or your abdomen. So you can tell if you have a bowel obstruction or pneumonia or pleural effusion in your lung. Broken bones, you
Right.
can see those right away. CT gets a little more complex.
I
And we have a
guess.
variety of exams that we do with contrast and without contrast.
Would you mind explaining what it's meant by with contrast?
So with contrast, we give you an X-ray dye,
Oh,
which
okay.
is an iodinated dye that lets us see your blood vessels and the blood supply to all your major organs.
Okay.
So we can see if there's a clot or an aneurysm, narrowing of veins and arteries. It's good for diagnosing things like Crohn's and
Oh.
diverticulitis.
Okay.
And again, if the patient's suspected of having a brain bleed, you won't get the X-ray contrast.
And now I did get that when I went to Edmonton.
If they know, if
Oh,
they can
okay.
follow it, yeah.
Oh,
But
okay.
before we do a plain one first.
Okay,
And then,
yes.
they can follow up with
Okay. So
Angio
is it
head.
contraindicated? Is that why? Okay.
just to say they know what they're dealing with.
Right, for sure. Yeah. Oh, there's so
But
many
there's,
things.
yeah, several. You can go on and on and on.
I guess so many different things to see what's going on inside us.
And often we all work together too with ultrasound is in our department as well.
Okay.
So if we find something in CT that can be better seen by ultrasound, the patient will go over for that, and vice versa.
Oh.
If they find something on ultrasound that needs a CT, they come over and we'll accommodate that as well.
Oh, that's great.
So everything works together.
Well, and
Usually.
it's fantastic that you're able to offer that to people so they get the best care possible.
The only thing we're lacking is an MRI machine.
I'm
But
sure they're
one
very
day, maybe.
expensive.
Yep.
Well, fingers crossed that we do get it here and it's easier. So, have you ever been in a position where you give the patient any results of the imaging tests performed?
No,
Oh, okay.
not really.
No.
If the radiologist says we can give minor,
Oh,
no,
okay.
you don't have a pulmonary embolus, or yes, you have a fractured ankle.
Oh, okay.
Sometimes we're allowed to say very minor things, but otherwise,
Right.
Nope.
That must be very difficult for you.
it is sometimes.
Yeah, because you'd be the first person to see if there was something wrong.
Yep.
And not being able to comment on it, that must be very difficult.
Yep.
I guess. Is that something that sometimes you take home, or how do you manage that?
Not really. I don't know.
No.
I seem to be able to leave that work at work, and
Oh, good for
so
you.
far, anyway.
Yeah. Yeah, no, good for you. So
But-
what sort of interaction do you usually have with patients who come in?
Everything. In CT, we get a lot of time to go through the questionnaires and find out their history,
Right.
which leads to small talk here and there. Plus, we have to start our own IVs, so you get to really know your patients.
Oh, so you're responsible for
Yep.
starting IVs?
Yep.
Ah, so that can be
So
challenging.
you have quite a bit of
sometimes.
interaction with them, and they trust you, right? So
Yeah. Oh,
You have
for
to put on a
sure.
brave face some days, but it's part
Yeah.
of the job.
Well, there's a huge amount of trust
Yep.
between you and the patient, isn't there? So you have a limited time to develop that rapport,
Yep.
I guess. So not only a imaging tech, you become almost like a friend, a
Yeah.
trusted person to them.
I suppose so, yep.
So I know when I had my first CT scan, the tech was so kind and caring, and we developed a very good rapport very quickly. But it was funny, she was so kind that it actually did make me suspicious, like, I'm going to be getting bad news soon, aren't I? But it didn't take away from her kindness, that's
Well,
for
good.
sure.
It's excellent to hear.
So you talked about the process for stroke care in Wetaskiwin. Have you been involved in performing imaging on someone with a stroke?
Yep.
So
I think it's almost on the daily that we do a
really?
question CVA stroke.
Really? So
But we have quite the older population, and it's not uncommon for them to have mini strokes.
So do you have a set process you follow then? Because we're not a stroke center here in
Yep.
Wetaskiwin.
So basically, we just do the plain head CT, and then if they're still suspicious, follow up again in 24 to 48 hours.
Oh, okay. Very interesting.
So we don't do a whole bunch for the stroke in town here, unless they catch it early, and then they can send them out to the city.
Right, right, of course.
So we're just basically a monitoring
Yeah.
center.
Well, further to that, I guess you had talked about in the diagnostic area that sometimes you could send someone over for an ultrasound if you suspect other things going on. So is it fairly common for a patient to have different imaging tests performed to determine what's wrong?
Yep.
Yeah.
Most often they start with X-ray
Okay.
just to make sure there's nothing abnormal showing on there, and then it can go either way, ultrasound or CT, depending on what they're looking for. Again, there's several ultrasound exams that I don't really know a whole bunch about, but I know in CT we often do follow-up hernias, stuff that
okay.
is difficult for them to see all the time. And then just the other day we had one for CT that they needed to follow up for an ovarian cyst, which they could see better on ultrasounds. So
Right.
they mix and match all the time.
Ah, well, that's great. I mean, that's for the best patient outcome, isn't it?
Yeah, for
So-
sure.
What appeals to you about your career?
Well, I quite enjoy it. I'm very happy that it's an 8-hour shift, not the 12 hours like nurses do. 12, 14, 16 hours.
Oh, yes.
We get a wide variety. So we do days and evenings and weekends and nights.
Oh, so it's not just a Monday to Friday
Nope.
job. Is there call-in then as well?
We used to do call in town. We'd work 4 till midnight and then be on call till 7 in the morning.
Oh, wow.
But it got too busy,
Oh, really?
and so they took away our call and gave us a permanent night shift now.
Really?
So there's someone in the department 24/7.
So you work rotating shifts then? Oh, that's challenging.
It is, but it has its bonuses too. You get days off during the week to do things when other people are at work.
That's true.
But then you work evenings and weekends too. So, and those ones you're by yourself. So evening shifts and weekend shifts you work by yourself.
And it's still quite busy.
Yep.
You're on your own. Oh,
Again, you can do anywhere from 15 to 30 or 40 a night.
really? Oh, my goodness.
Mm-hmm.
That is something. So would you say night shift is the challenging part of your career, or what are the challenging parts?
I definitely personally don't like the night shift
Yeah.
when you come home to a 2-year-old
Oh, I guess.
and finding childcare, but there are some downsides. We are currently in the process of fixing some equipment that is in desperate need of replacement
Right.
in the X-ray department. We just got a brand new CT scanner though.
Oh, really?
2 years ago.
How exciting.
The foundation raised $1 million for that.
Really? Wow.
So that was fantastic.
That's great.
And now we slowly need to replace the rest of it. But
Yeah.
I don't really think that there's too many downsides other than the busyness and the clientele once in a while. But
I guess doing the night shift, there could be quite a variety of people coming in.
and some with security guards. Yep.
Oh,
So-
that's...
But I myself don't seem to have a problem with that. And then I don't know if it's because I grew up here
right.
and know how to deal with some of them.
Right.
And that I'm not small and tiny and petite.
Well,
I think makes a difference. But yeah.
From what I've seen, you have a very bubbly and compassionate personality. So probably
try,
that
yeah.
helps put patients at ease. So what would you say is the most fulfilling part of your career then? If you don't mind me asking.
Just the patient care and trying to make it a better place for them to be. Nobody's there for the fun of it, right? Yeah, they're there for a specific reason. And yeah, I don't know. Trying to work with the other departments and get things on the same page,
Right.
which is a struggle some days. But
Whenever you're dealing
everyone's
with...
short-staffed and overworked and not enough money for equipment and da-da-da-da-da-da.
The challenges, that's for sure. So in spite of that, where do you think medical imaging is heading in the future?
Well, I think the sky's the limit, basically.
Really?
It just seems to be getting more and more advanced every year. I do work with Nate,
Oh, okay.
with the students coming out.
Oh,
So we have a student program as well.
really?
So each year we get a student from the X-ray program. So I'm go to Nate twice a year for their
Okay.
meetings, keep in touch of what they're teaching the new students.
Ah,
They have a fantastic new simulation center
really?
at Nate, and it's for all the imaging students for ultrasound and paramedics and respiratory.
Really?
They have live mannequins. They have
Wow.
operating rooms set up with mannequins that can be controlled.
Wow.
They have a mannequin that can give birth.
You're kidding.
No.
Oh my goodness.
It's fantastic what they have there. So you never know what they can come up with, right?
And I guess through your contact with them, you're keeping apprised of all the new technology.
I sure wish they had that when I was there. And I think they keep it so that when the students graduate, they're more prepared for what's to come. I don't think anything really prepares you for the real thing, but
Try
it's
to
helpful.
come as close as possible.
But the scanners are getting faster and more detailed, and they've completely eliminated film and going
Really?
right to digital imaging now. So
And being in X-rays, there's still the same amount of radiation? Because isn't that a concern with X-ray, radiation
Yep.
exposure?
it's getting better.
Oh, okay.
X-ray is still the least amount of radiation.
Oh,
CT
really?
is the most.
Oh, okay.
So you don't want to do too many of those in a year if you don't have to. But it's really not a whole lot
Right.
for once in a while.
Yeah, and
We stand behind a lead shield
that's, well, being
unless
in
we
it
have to
every
hold a
day.
patient. Yeah.
Yeah.
So it'd be different if you were in there every single day. But
Yeah, that's for sure. Well,
When you
thank
have
you so much for that. So I guess lastly, from your viewpoint of having performed hundreds of imaging tests, sometimes in the matter of 2 shifts, any words or advice for people awaiting tests or unsure of what's next after they've had a test completed?
I would definitely say patients should take more of an interest in what's happening.
Okay.
Every single day they show up without having a clue as to why they're there.
Really?
So ask your doctor why and
Okay.
if it's necessary, and just do a little bit of research to make sure that that's what you need.
Yeah, so they can be their own advocate? Is
yeah,
that what
for sure. And then definitely follow up for results.
Oh, okay.
People just think that they'll get a phone call telling them if something's wrong, and that's not always the case, right?
Oh, okay.
Things can get lost in the shuffle.
Right.
So just be sure to follow up with your results and, be your own advocate.
Oh, that's
'Cause
great
nobody
advice.
else will do it for you.
You're right about that. And we've heard that before from
Yeah.
other guests. So thank you for reaffirming that.
You're welcome.
Well, thank you so much for your time and expertise and, pardon the pun, giving us an inside look into the vast subject of imaging. It's amazing from what you've shared how far imaging has come, even in the training and the technology,
Yep.
and exciting to think about where it might go. So, yes, we appreciate your time. So remember, next time you need to have medical imaging done, all the work and knowledge and expertise needed for each test and by every tech. Thank you.
You're welcome.
Did you know that you can follow us on Twitter at 7Jars? We post daily with all the latest stroke research, innovation, and inspiration. Follow us. Now it's time for the joke of the week.
Hey, Ken, do you know why you should never lie to an imaging tech?
No, why?
They can see right through you.
Now it's time for our segment on survivor stories. We'd love to hear from you. If you'd like to share your own stroke or survival story, or your experience as a caregiver, you can submit your story through our website at 7 Jars of Hot Pickled Peppers, or personal message us on Facebook. We look forward to reading your story. Our survivor story this episode comes from Danielle and is read by Christine.
Life is so weird. I survived being electrocuted as a kid. I put a metal pin in an outlet. I remember the pain and my hand being burnt. But today, no one would ever know unless I told them. Now, 38 years old, recovering from my hemorrhagic stroke, January 2017. I had passed out at home. Apparently, I got up to use the bathroom, but my boyfriend of 4 years said I was sweating like crazy. He thought I took a shower. I told him something was wrong, call 911, then passed out on the bed. My boyfriend said the paramedics came. Then he had the police sent to my dad's house because my dad wouldn't answer the phone. My boyfriend was scared and didn't know if I would make it. He didn't know what was wrong with me. He knew I never used drug, wasn't even a smoker. I was maybe a 15-minute drive from the hospital. I was airflown from my apartment to the hospital down the street. Apparently, an MRI was done in ER. Doctors found 2.5 brain aneurysms in the back of my head. One was going to rupture. Doctors had to release the pressure in ER or it would have killed me. My hair was long and curly, but it had to be cut and shaved for the brain surgery. The team of doctors say if I wasn't young, I never would have made it. I was in ICU. My family and pastors were called. Doctors said it was a waiting game. I say God was in my room, in surgery, and touched the doctors and nurses. God woke me from a coma like 1 week later. I saw my birthday in 2017 in rehab. My dad brought presents. My sister in the Air Force mailed me. I have 4 younger sisters. They are a bit pushy and mouthy. Jersey girls to the fullest. I had rehab and numerous swallow tests done. I'm just thankful to be here today. I went home from rehab in November 2017. My boyfriend of 4 years, who was about 40 years old, broke up with me in rehab 1 month before I went home. All the emotions I was going through, and now this. On top of having a stroke, now a breakup that was unforeseen. We didn't have any problems. I'm really fighting for my life now. My life before stroke, I was single, no kids, independent, had my own car, apartment, 2 jobs, partied, traveled whenever I wanted, and moved to Texas in 2012. to now, none of that independence and the effects of a stroke and a breakup. The stroke left me with an abdominal scar from the feeding tube, a trach scar, depression creeping in, finding a new life. My friends are becoming scarce, fatigue, balance issues, vision issues. Will I ever find love again? What is next for me? My faith is definitely stronger, but what does my future look like? I don't know.
Thank you for sharing your survivor story, Danielle. Everyone's journey is so unique, as are the challenges of their own personal roller coaster ride. Now, for today's Stroke Link.
When I was first in the hospital for my stroke, I had no idea what to expect and what all these different tests might mean.
I know, it was a scary time. But the staff were kind and they tried their best to explain what was going on.
Oh, that's for sure. I know information is power, and I wanted to know more about medical imaging and stroke, so I found a website that is very informative.
Yeah, you shared that one with me too, so I looked at it. It is an incredible resource. It can help people understand what tests they had completed or what to expect from a particular test.
It starts right at the beginning with describing stroke and then continues explaining the tests that may be completed and why.
And one of the things I like best about it is it's written in plain, understandable language, and there are many links to click on for more information about different medical imaging tests used for stroke.
Yeah, it's a great resource. Type radiologyinfo.org into Google. Then type stroke into the search box. Click on the first choice, stroke. It brings you to the page with all the relevant medical imaging information. We recommend this site. And don't forget FAST. It's an easy and it's the best way to help you remember the signs, symptoms, and what to do if you or a loved one may be having a stroke. FAST, face, arm, speech, time. A stroke can bring on unusual symptoms like numbness, tingling, drooping, or paralysis on one side of your face or one arm and can affect your speech, slurring or jumbled. T for time. Don't delay. Get medical help immediately. If you suspect a stroke, you can call 911 in Canada for emergencies, or if you have questions, call HealthLink in Canada at 1-866-408-5465 to talk to a healthcare professional.
Thanks for joining us today. Don't forget to like us on Facebook, or if you have any questions, comments, jokes, or ideas for future topics, contact us at our website, 7jarsofhotpickledpeppers.com. We'd love to hear from you. If you'd like to hear more about Kristine's journey, please check out the website. Her book is available for purchase. Special thanks to Kevin Jackson for his trombone work and for making our videos on YouTube every episode.
Thank you for joining us today. We know life can be tough, unfair, but you're stronger than you think, and you're not alone. Goodbye and good health.